This is Breaking Down Security. I am Brian Brake. Welcome back, dear listener. Firstly, I would like to thank everybody for donating to Hackers for Charity. If you were trying to get a DerbyCon ticket, we gave that ticket out on July 31st. We'd like to thank Tom J for winning the ticket from us. He's going to go to DerbyCon, and we are going to interview him at some point on the podcast. Before I get too far into it, I'd like to welcome back Mr. Betcher after his little hiatus, his little sabbatical, his leave of absence. He went on something called vacation. Welcome back, sir.
Right. Thank you. Thanks. A lot of driving, but I'm glad to be back. Glad to be doing what I love to do. And, hey, it's nice to see your pretty face.
Now, I know you're lying. You know I have a face for radio. So where did you go on your vacation? Did you say you just drove around? Would you go down to, like, Galveston in that area, or did you actually go and see stuff?
I drove 5,300 miles.
Oh, God, really?
Yeah. We went almost to Canada. We drove through, I visited so many states. Montana, Colorado, Arizona, Oklahoma, Kansas, Nebraska, South Dakota.
Okay, the last four don't matter because they're all flyover states. So you did go to Devil's Tower, and you did see Mount Rushmore, and you did all the Americana stuff. You were a tourist in our own countries.
National parks, love to hike, so we went on a lot of hikes and fished and did all kinds of stuff up there.
Oh, nice. Okay.
So yeah.
Very nice. Well, I'm glad you're back. I'm glad you're back safely. We thank our stand-in guests, if you will, Miss Fabienne and Megan Tottenkoff, and of course Mick Douglas and Jared Freitas for filling in. We'll definitely want to have those folks back on again very soon. So this week we're gonna head into an area that I've really wanted to get into. When I was a consultant working in Austin for a company called Synergistech. Good little InfoSec compliance group. They don't pay me to say that. They're just really good organization. I got to audit some hospitals, and I got to understand a little bit more about how HIPAA works and how 21 CFR 11, red flags rules, all those kinds of things. I got into the world of medical compliance and privacy and data privacy and such, encryption at rest, and making sure that patient records are safe. And the podcast, we've always wanted to get into a little more of the healthcare and the privacy side. And I went to a meeting here in the Seattle area of an InfoSec organization that I'm apparently I can't talk about publicly. And I met this lady during one of the breaks. Her name is Catherine Carpenter, and she is a bioethicist and a data privacy consultant. So I'd like to welcome Catherine to the podcast. Thank you for being here.
Thank you for having me.
Right on. Maybe everybody has an origin story. Catherine, maybe you could tell us a little bit about your background and data privacy and what a bioethicist is.
Okay. Well, I really wanted to be a geneticist when I was in undergrad. Mm-hmm. And at the same time, I also didn't really understand I didn't really get organic chemistry. So I switched from studying genetics to to studying sociology because I could study philosophy and medical ethics at the same time. And I ended up working at the Seattle Children's Hospital for 5 years after that, helping with bioethics research, which in that context was making research more ethical. Medical research more ethical, specifically research with children, because that's the research that they were doing and that they cared about. And toward the end of that time, I also served on an institutional review board at the University of Washington, where we reviewed medical and socio-behavioral studies that people were creating and trying to get past the review board. And so we basically, the group that I belong to, we basically advised them about how to make their research studies more ethical and improve their research design. And all of the privacy work that I've done, I sort of stumbled into by accident, but it was really interesting, and so I kept doing it. And I think that privacy is really important in healthcare as well. So I'm really happy to be here so that we can talk about all of these things.
Absolutely. So you worked on something before we get into. Actually, you know what? I'm going to wait on that. One of the things we wanted to do when we're discussing this is we wanted to do some explanation of terms. So I had, when I worked as a consultant, we always had to deal with something called de-identification of data. Maybe you could explain to us what de-identification of data is and how HIPAA requires that.
Okay. So, well, de-identification of data is basically when someone goes through all of the data and takes out all of the pieces that are deemed identifiable. And that could be your name, your zip code, your social security number, your medical record number. HIPAA has 18 identifiers. Mm-hmm. And I don't know if you want me to go through all 18 of them.
No,
but they're basically identifiers that you would expect in a medical record, like your name, your address, your social security number, your medical record number, your county, your state, and then it also includes your IP address. And then there are 17 specific ones and a general one that says anything else that could identify this particular person. So all of those need to be taken out. Mm-hmm. And once they're taken out, the record is supposedly de-identified.
Okay. So when would they de-identify it? Because, since I was a kid, the doctor always had this chart on me and it had all my info on there. And of course, I could never look in there. And I'm assuming that they didn't go in there and just Sharpie everything out. I mean, when do your records stay intact and when are they de-identified?
This is specifically for research purposes. So your record needs to stay intact when it's at a hospital and it's actually being used for your care. And when your information is being used for a research study, that's when all of the identifiers are removed so that it protects your privacy.
Okay. All right. So so you said like there was a general one. So what you said there were 17 specific ones like URL, IP, which I didn't even know about those. That's interesting.
Yep.
So the general ones, like if you had in the comments that the person has a limp or the person has one arm longer than the other, that might be an identifying feature of the person that would have to be anonymized.
Yes. And you can't include fingerprints or their recording of their voice. You can't include their pictures of their image, of their face. You can't include those. You can't include anything that would identify their devices, like computer MAC addresses or your phone MAC address.
Interesting. And I'm assuming this is all given rise because of electronic medical health records. When people go to check their information on, say, a web portal or something, you would be able to pull the IP address of where they came from and their MAC out of log files, basically.
I think that is relevant, but HIPAA was passed in 1996.
Okay. So
it's a little bit. It has been modified. It has been modified. So it's possible that the more web-related components in the 17 identifiers were added later. But it seems, I think it's more if someone is in a research study and they're calling from a specific phone number, mm-hmm. or they're calling from a specific computer, or they're logging into a website from a specific device, then and you're recording that information as the researcher, mm-hmm. you have to remove that from the log file. You can use it to verify that it's your research participant.
Okay.
if you need it as a verification tool. But then when you actually store the data about the research project, you take that out of the file.
Okay, very nice.
Now, you said privacy is important in healthcare.
Yes.
Why is that? Why? What could happen? I mean, because I know many people who say, I'm not big on privacy. I don't care. I mean, what could happen to me, right? So can you go through some scenarios or things that might happen if your healthcare data were to become not necessarily public, but searchable, or someone could have it, some company or whatever?
Well, actually, I have a really good and very very current example. 23andMe can now restrict you. Their API can actually restrict you from going to different groups if you don't have the right genomic data.
What is 23andMe?
23andMe is a company that allows you to basically get a genetic sample of your data. You spit in they send you a kit, you spit in a tube. It's pretty cheap if you sign up for their research program. I think it's $100, and then they do research on your DNA. And I think it's $200 or $300 if you don't do that. I don't remember exactly how much it is. Anyways, they will actually tell you
free,
all of your genomic data. So you can get a whole readout of your genome from them, and then you can be part of different groups for if you have certain diseases, or if you're part Cherokee, or part Ashkenazi Jew, or part African American, or part something else, Scandinavian, then you can be part of these different groups in their organization. It's sort of like an internal social network to encourage people who have certain genetic traits to work together to solve different problems. Or
are these members only? I mean, if I join the Comanche group and I'm not part Comanche because of this 23andMe, that I can't get in?
Well, I'm not entirely sure how they restrict different things, but I know their API can limit you from going into a specific group if there's a genetic limiter.
Okay.
Yeah.
So
and we had that. We talked about that last week. There was a story about a website that actually used the API call and was actually able to deny people access to that actual site. And once 23andMe found out about it, they canceled that API key, so the guy couldn't use that anymore. But there's actually a GitHub project. Yeah, there's a repo out there where somebody has posted the code for that. So if you ever wanted to add that to your website, you could do that. So there is coming the day where people. The thing is, though, with the 23andMe, you've got to opt into that. They don't share that information unless you I would hope explicitly say, yeah, share my information out. But it is coming to the point where we are having to worry about, genetic makeup and, access to various things on the internet.
Yep.
Which I found quite interesting.
But other than that, if someone finds out you have a health problem, or even something like you smoke, or you eat too much red meat, or something like that, you could have an insurance company raise your premiums. You could have gym memberships go up. You could have certain doctors say they would or wouldn't see you. So sometimes it could be a benefit because you might have more access to, say, quitting programs if you have an addiction to alcohol or cigarettes or something else. But it could also be negative. It could negatively impact your life in a bunch of different ways.
Now, is there U.S. I thought the government had passed some kind of equal opportunity requirement that a company could not discriminate based on genetic markers or genetic information? Is that just for employment benefits, or is that for insurance as well?
I believe it's supposed to be for both employment and insurance benefits. But it doesn't mean that it won't happen. You just have to be able to prove that that's why your rates went up.
Yeah.
So it makes it a lot harder. I mean, companies aren't supposed to do certain things, but sometimes they do them anyway.
Sure.
I don't see how you could find out. Like, your rates go up and down all the time. Hopefully they go down, but usually they go up, right? And there's no telling what factors into the actuarial calculations of your healthcare rates, right?
Right.
And this kind of reminds me of a story. I told this at a OWASP talk I did. I went to I downloaded this MP3 player that had ads, and I would get the default ads like for games and stuff. But I went to a certain convention in Louisville. I don't know if you guys have heard of that before, but I went there a couple days early, and I visited things like the Louisville Slugger Factory, went to the horse race derby, and then I went to the Jim Beam Distillery. And then on the way home, I started listening to MP3s, and then I started getting ads for Wild Turkey, Maker's Mark, Jim Beam. And so the ads had changed based on where I had been. I had never searched Jim Beam on the phone, but now I started getting ads, and that leads me to believe that, okay, somebody knows I'm interested in bourbon, so does that put me at a higher risk for becoming an alcoholic?
Yes.
And would my insurance rates go up as a result? Because now I'm put in that category. I at least have tried it, or I know about it, or I do drink, occasionally. At least I'm interested in it because I was there.
Yeah. Yeah, it's interesting how that data can be used all over the place, whether it be, that app was, doing a course GPS lock on you. So it knew you were in Louisville. It knew you were visiting the Jim Beam Distillery. It knew you visited the horse track, that kind of stuff. A lot of apps on mobile phones will take that kind of info, being as esoteric as possible, and tailor the ads for that. And then,
would they sell that information to, for example, an insurance company if they knew who I was, or they could correlate this de-anonymized data?
That's an interesting thought. Maybe we should ask an insurance company.
I don't know that data necessarily has to be de-anonymized, because that's not necessarily healthcare data. And that's one of the big issues that I have with the way that we deal with healthcare privacy and all other privacy is very different. So they might have sold their information, and actually they know that it was you. Your phone service provider or whoever was doing your maps when you were using the map application, because there are far less stringent protections on privacy outside of the healthcare sphere.
Okay.
So,
do you have Verizon Betcher for your cell phone?
Oh yeah.
Oh, then you got the Verizon Super Cookie, bro. Yeah,
I know.
You got Super Cookie all up in there.
You're screwed.
Yeah, you're screwed. Yeah.
Oops.
So there are various. We mentioned the HIPAA privacy rule already. We've mentioned there's another. Okay, so at the beginning you had mentioned trying to make research more ethical. Is there a specific privacy framework or compliance framework that is required by research facilities to follow when doing this to ensure that they maintain an ethical standard, or is it just up to the various research organizations' advisory boards, or so to speak?
Well, yes, both to a certain extent. Any research in the U.S. that receives federal funding has to comply with 45 CFR 46.
Okay.
And that is basically making sure that people keep information confidential and that there is an informed consent process by which people understand what they're going into when they participate in research and that they agree. And I mean, those are sort of the two big pieces. It's a little more complicated than that, but the 45 CFR 46 is the really big one for medical research that's funded by the US.
Okay.
And other research follows the Belmont Report in the US.
Okay.
Which is a report that basically created a bunch of ethical standards, including having the participants be autonomous, which goes into the informed consent piece. Making sure that the research is going to benefit them somehow. It's not just for fun and not potentially harmful. So the goal is to actually create generalizable knowledge that you can improve the world somehow. And also you want to benefit the participants and minimize any harm. So certain research is dangerous enough that there will be some harm, but if the benefit is greater than the harm and you minimize the harms as much as possible, then potentially it's okay, as long as people agree to be part of it and the institution says it's okay.
Okay.
So there are a lot of different hoops you need to jump through in the research context. And sometimes it seems like they're good enough, and sometimes it doesn't seem like they're good enough. But at least they're there.
Okay. So like the HIPAA requirement just recently got a little more bite to it because the Office of Civil Rights is doing audits. This is probably a couple of years now. What, if any, kind of ramifications happens if an organization or a research group don't follow 45 CFR 46 or follow the Belmont report? Do they get a slap on the wrist? Is there fines? Is it, or are we talking like some really like heavy litigation?
It depends. It depends on the context, and it's been all of them.
So
at
severity
thing.
It
depends on what happened, who messed up, how bad someone got hurt, or how much damage to a person in the or many people in the research context. So all of those things can happen. A researcher, they could lose their federal funding. They could have to pay a fine. They could have to give back federal funding from however many years. Also, they would potentially be able to be sued. So they could suffer from the cost of litigation and however the litigation turned out, even if it was in their favor. Potentially, and in some of the most egregious situations, it's usually not. So
they could the researchers, the research group lose their ability to do research, period? I mean, or does it work like that? I mean,
I'm not entirely sure that it works like that, because that particular organization might lose their ability to do research, but all of the researchers could end up going and working for somebody else, and then they would be able to still do work in the same vein, potentially.
Okay.
So,
if one researcher does something that gets that research group in trouble, everyone would just go their separate ways, and the guy who necessarily did it, there's no ramifications for the guy. It would be on the organization that was running the research in this case.
Well, there could be. So say the person who was running who messed up, who was running the organization, was a licensed medical doctor. They could also potentially lose their license.
All right.
If it's a PhD running the program, they could also lose certifications, but it's a little more complicated because there's not you don't have the license to lose. There are different ways of certifying research.
Okay.
If you're a PhD running the program. But usually there's a pretty big reputational hit. So
good.
If there's publicity about it, and if it's a really big mess up, then there could be ramifications besides just a fine or losing your research funding. It could also impact your career.
Okay.
But it also, depending on the person, sometimes really charismatic people are able to slide out of those situations and right into something else. So it depends on the person and their situation and what they want to do.
Okay.
Yeah. Can companies sell healthcare data as long as they anonymize it without your consent as a patient?
I am not sure that they're allowed to.
It would be hard.
To HIPAA,
it would be hard to prove.
HIPAA, yeah. Well, according to HIPAA, if it's de-identified, then yes, they could
do whatever they want.
They could potentially share it. Whether they should or not, that's a different question.
Yeah.
And whether the information is actually really well de-identified so that it couldn't re-identify any of the people, that's another question.
Let's talk about some of the ways that this data can be re-identified. How does that work?
Well, I'm not
Are we not
sure
supposed to go there, or what?
I'm not sure I'm really supposed to go there. Yeah, no.
What
I can really say is, if there's so much information about us in various places already online, the way that you answer your secret questions, whatever tracking you have for your map application, whatever you put on various social networks, whether it's for work or for fun, all of those things can help re-identify you, even if your healthcare profile is de-identified. And your birthday makes a difference too. There are only so many of us with different birthdays. So all of that makes it easier to re-identify people potentially, because even if you have one data set that has most of the identifiers taken out, if you cross-reference 15 other places where you have some information about most of those people, it's likely that you would be able to put together a puzzle and re-identify at least a few of them. Maybe not all, but definitely enough to make it possible to identify the rest.
So that's a good image, a puzzle, because I've seen on TV where they go, okay, how long does it take you to identify what this picture is, right? And it'll be a picture of the Statue of Liberty, but they'll only show like a small piece at a time, and after about 4 pieces, you know what it is. So it's kind of like that. The more pieces that you have, the better your odds are of identifying what the image is.
Well, it's like doing reconnaissance on a pen test. You're going out. You want to know who works for the company. You want to know, if that person is a fan of a specific local team, or what their kids' names are, or what their wife's name is. In an attempt to socially engineer them. If you can find that information, I try to do my best to not advertise who I work for, but I bet if you looked hard enough, you could figure out who I work for. Same with you, Mr. Betcher. I mean, you advertise it on your LinkedIn, but I'm not saying you do, but you do. And so it depends on how private you are in your real life as to how private you are in your medical information.
Well, the other thing is, if you have an account at a drugstore, the drugstore knows what your prescriptions are. Now, they're not supposed to sell that information, with your name on it, but they do keep track of it, and they do sell some of that information in different ways. And even that is a way, that's part of a puzzle. So if you're in a certain area, you can actually use prescription information to help identify an individual. If you know a little bit more about them.
Yeah, especially
and that's kind of scary.
Especially if the town is small.
Right.
You know, the smaller the better. You know that there's only so many people who come in for regular prescriptions. You know, you can figure out pretty quickly who is who by by the rhythms of people. If you get a 60-day supply, you know that person X is going to come in for their heart medication every 60 days or so. You can figure those kinds of things out.
Well, the people in the pharmacy will know.
Sure.
Because town, but the way that they track that information, that actually goes back to drug companies and to other organizations. And so thinking about taking a bigger data set, even if the prescription information, who's getting the prescription, is de-identified, you might be able to track it by who's on Premera, or who's on Premera who lives in Tennessee, who uses a bunch of different things and is male or female. That's potentially a way to start piecing things together.
Sure. All right, so you've got all these companies and they have all this data, and let's say a healthcare company that happened recently, like Premera or Anthem, the Anthem breach, the Premera breach. How do you set a value on the data that they have? Because I mean, what you see is it only seems like that the value of data is set by, say, the lawsuit, because lawyers are suing for damages and they set a damage according to a specific number times a modifier. How does a company take this data and go, okay, we're sitting on $1 billion bomb here? And I mean, do companies actually know how much their data is worth, or are they just playing fast and loose with a lot of it?
I don't know if I have a really good answer to that question, because I'm not a representative of any of those companies. I'm fairly certain health companies have a good idea that the data they have is worth something, even if they maybe have to tell people, even if they have to potentially de-identify the information that they would sell or use for marketing purposes or something else. I don't know if they realize, past or present, how much damage it could be for them if they were breached, if they weren't careful enough with the data. I think we're still learning about how much damage that has the potential to cause. But it's pretty big.
Yeah.
I think it it will probably be a really big impact on companies.
Well, the reason I'm asking about companies don't understand the value of their own data is when a blue team person or a person who's in information security or in IT goes, we need new XYZ system because that's going to help protect our data. And you're sitting with a C-level folk, or you're sitting here with the director of IT, and their eyes glaze over because they're like, we just have data. We don't need to spend $3 million on this new system. What's wrong with the system we have now? Well, when you tell them, well, the data we have is valued at $3 billion, you could say, okay, maybe we need to spend $3 million to protect $3 billion or something like that. I think it would be helpful if there was a way for companies to understand the value of the data that they hold, either in the form of, I don't know, what it costs on the black market. When I was a consultant in Austin for Synergistic, I heard it was like $50 for a medical record. So if you've got 100,000 medical records, you're sitting on $5 million, $5 million worth of data. So that would make it easier if you could quantify the, how much your data is worth to a lawsuit, or in the event of a lawsuit, or, for like the OPM breach. Oh my God. Like they had tons of data, and you find out that their IT systems were woefully inadequate. If they knew the value of their data, would they have been more likely to spend money to protect that? And that would have been a better, a carrot, if you will, for a defense, the blue team folks, to say, okay, we got a ton of data here, we got a ton of value that we need to protect. And I just think that there should be a way to figure out how to quantify that.
I think it would be really nice to figure out a way to quantify it as well, but I think the value will change over time. I mean, stolen credit card information used to be worth a lot more than it is now.
Yeah.
Now I think you can buy something like that for $1 or something ridiculously cheap, because you can't use it for very long, and it may or may not work. And so it's possible that health medical record data will also become worth less over time on the black market. But I don't know that the black market is necessarily the way to create valuation of the data anyways, because the company itself can make a lot more if they manage to keep the data. They can probably make at least several $100s per medical record if they're selling de-identified data for marketing purposes for new pharmaceuticals, or some kind of different insurance policy, because the insurance company will make money if patients switch to their plan. So I think ultimately the problem is less maybe creating a valuation for the data, and more finding a way to talk to people in charge of budgets about how protecting the data is worth money.
Yeah.
Because even if the data is worth nothing all by itself, say it's a trade secret, nothing, just sitting there in the lab, it could be worth a lot if it's stolen.
Yeah.
And keeping something secret or protected is actually not that hard if you plan it right. I mean, it is hard, but it's easier to do if you have a good plan in the beginning than to fix something that's already broken.
Yeah. And I guess a good point is, if you've got breached, it's going to affect your other agreements with, companies you're sharing data with. You're going to, not only are you going to lose money in the lawsuits being sued by people whose data you have lost, you're also going to lose it with, the marketing company that, is going to be taking that data, because one, if they're unscrupulous, they'll just go out and get that data from wherever it got posted. Or two, it'll hurt in future possible negotiations, because, company Y won't want to do business with you unless, you can show good faith that you've actually improved your systems post-breach.
Right. And actually, in the research context, when you're sharing information and it's if it's not de-identified, or if it's only somewhat de-identified, you have to be able to show that you are protecting it to a certain level in order for other companies to agree, or other organizations to agree to share their data with you. So when I was working on different agreements for the Colorado Children's Hospital, they had me help them with an agreement about sharing research information with another organization that was affiliated with them under an umbrella, but not part of their organization. And they had they wanted to make sure that the other organization was going to keep their data very safe.
Sure.
Because it was if they didn't protect it enough, then they would both get into trouble.
Yeah, and you're talking about kids' data at this point, which will follow. HIPAA requires you to keep track of that data all the way up until age 18, at least,
right,
when the person is no longer a child. So, yeah, that's kind of a big deal. Yeah, I know that third-party agreements and health systems were starting to be a big thing when I left the consultancy, because a lot of companies, you go in and you ask them, okay, your medical record transcriptionist company, what are they doing with the data once they're done transcribing it into an EMR? Well, we don't know. We're assuming they're being safe with it. Well, there's nothing in their third-party agreements stating that, you're going to securely destroy that data. The hospitals were just assuming that they were doing that, and you could find it in dumpsters out behind the people's house, medical records in dumpsters and stuff. And so, it's important to make sure that everybody is protecting that data altogether.
Right.
So.
Well, the other thing is paper's not entirely safe either. You can have a big, I don't remember exactly when it was, but there was someone was moving a huge amount of paper medical records in a truck, and the truck had an accident, and most of them blew away. And so people just had all of these medical records floating around this random stretch of highway. Anyone could have picked it up. Now, who knows how many of them were ruined by weather or found. Yeah. But that also was a really big liability for that was moving the records.
Yeah. Wow.
So
that's awesome. Mr. Betcher, do you have any other questions for Ms. Catherine?
Well, I wrote down a takeaway, so we'll get to that later. But how concerned should we be about privacy? We talked about how companies can make money off of my data, right? It's not their data. I don't consider it their data, right? It's really my data. So they're out there selling my data, right? And the whole bourbon thing, apparently all the insurance companies know that I'm now a drunk, or I have the potential to be, right? So, I mean, what do we do?
Oh, I don't know if I know what we do. I'm very concerned about it also. I think privacy is important, partially because we seem to care about it and we seem to be losing a little bit more every day. But I feel like the most we can do is be as safe as we can and be aware of what's going on, and limit your exposure wherever you can. And the sad thing is, related to the beginning of your comment, yes, companies are selling your data and my data. And right now, we don't actually own the data. Like, they can actually claim ownership of the data that's actually about us more than we can, because they collected it according to laws in the US. And that bothers me as well.
Yeah.
But that is how the law is right now. So
yeah,
we can maybe work on changing it.
Yeah, and it really behooves people who are donating that information, or asking your doctor, hey, what does the healthcare system do with our information, or being more cognizant of the fact that your information could be shared. So you need to ask these questions as a person to go, okay, where what's going on with my data? How's it being shared? Are you people doing what's necessary to protect my data? And I'm sure you're going to be asking a low-level functionary, but there's always people in a healthcare system that will be able to tell you. Your compliance weasels there. Any healthcare system should have a good handle on where that data is being shared and stored, and and handled. So, and they always have. You can always have ask for redress. You can always ask for an accounting of where your data is and who's looking at it, and so there are supposed to be, for many healthcare organizations, processes in place to allow you to see who's been looking at your data and what for. So
that's true. Well, the other thing that is interesting, an interesting counterpoint perhaps, is in certain areas of research, the privacy protections we have in place actually inhibit research from taking place, because if everything is anonymized or de-identified, then it's harder to group people into their specific places where
Risk.
you can understand what disease they have and how the disease progresses over time, because even if they're in a longitudinal study, you don't know who it is and how they're improving, and you can't connect them to other people who are similar. So
Yeah.
that is the potential problem with wanting privacy. However, the people who might be willing to give up their privacy in those particular contexts will actually do it. It would be an opt-in thing, sort of like 23andMe.
yeah.
And I think if people are really willing to go there and give up their privacy for their own health or to better other people's health in the future, we should let them do that.
Yeah. Yeah, that's very good. Very good point. Very good point. Mr. Betcher, you said you had a takeaway that you wanted to give up. I think we're
Yeah.
almost at the end of our time here, so I think we're going to have to.
Yeah, I have to
come
get
back.
the liquor store before they close. You know what I'm saying? So,
dude, you weigh like $1.10 wet, so you're not, a jigger of rum and you're done.
So my takeaway is watch what you install on your phone, right? It goes back to my story. An example I have is I wanted an app for a flashlight on my phone. And I started looking through some of the apps for a flashlight, and you basically give up your phone to this flashlight app, right? They take everything, your contacts, everything, maps, your geolocation, file system access. And then I finally found one that just accessed the camera, and that was it. It was called the Privacy Flashlight. And they had to say, oh, it's a privacy flashlight. So you would say, oh, okay, well, there were probably 50 or 60 that I scrolled through, and that was the only one that didn't access things that it shouldn't have.
So, okay, so you had options. So you
I
had
did have
options,
but it took me a while to find the one that that was actually what I needed that didn't get more than it had to.
Yeah. Well, I learned today that research companies have a hard time taking de-identified information and trying to make it useful. I did not realize that privacy actually inhibits research, which, when you think about it, makes sense. So I appreciate that point, and I thank you for making that, Catherine. So
You're welcome.
yeah. So how would people get a hold of you if they wanted to continue this conversation with you? I know you're on LinkedIn, but you don't have a picture on your LinkedIn. And Catherine Carpenter, there's only about 40 of you on LinkedIn. But do you have a Twitter? Do you have a blog? Could they get a hold of you through email or?
I'm okay with people sending me email. I have been considering starting a blog, but I don't have one at the moment. And
Privacy
my
blog.
yeah. You would be surprised how many people have encouraged me to start writing one. So I might actually do that. We'll see. But it hasn't happened yet. So
that's okay.
For now, I guess email, and I don't use Twitter very much. I have an account, but it's private, and I think I have like 5 followers, and I follow, a handful of friends.
Well, you know why you only have 5 followers, because it's private. So I mean,
yeah, that's fine.
All right. So, do you speak anywhere? Do you attend conventions? I know of one that's coming up soon that we have a drawing for on August 8th. If you'd like to enter that and you join us at DerbyCon.
I'm not sure I'm available August 8th to go, but I would actually I do speak. I speak on actually cybersecurity and data sharing all over the world over the last 2 years. I have been speaking in Estonia, Australia, all over the US. Okay. And I hope to keep doing that a little bit. I'm not sure. I don't have any speaking engagements coming up at the moment.
Okay. But you are available for speaking engagements. Right on.
I am available for speaking engagements.
Very cool. Okay.
And yes.
Very nice. Mr. Boettcher, tell us where you're at on Twitter and the LinkedIn and the Face Spaces.
Well, I'm on Twitter at Boettcherpwned, BOETTCHERPWNED. And I can also get emails at bds.podcast@gmail.
I can too.
Yeah.
We share that password, unfortunately. That's security fail.
It's not very private.
I know. It's cool.
Wait. What about BBS 1 and BBS 2?
BBS 1 and BBS 2?
Yeah.
Well,
because then you would have your own accounts.
Oh yeah. Well, I mean, he likes to go in and look at feedback and look at the people who've entered for our ticket drawing on August 8th for that second ticket. Speaking of which, we do have a second ticket. I mentioned Tom J at the beginning of the podcast who won the first ticket. If you want to go to DerbyCon, and I understand that the tickets are probably non-existent right now, go and donate at Hackers for Charity and send us the receipt at bds.podcast@gmail.com, and we will enter you into the drawing for the ticket. You'll have to meet us at DerbyCon, so you'll have to get in contact with us, and then we'll meet you at the registration table. But other than that, that's all you need to do. We'll contact you if you win, or post the winning up on Twitter. So our Twitter handle for Breaking Down Security Podcast is @BreakSec. You can find me at Brian Brake, BryanBrake. We're on. We thank our Patreon people for donating. We're glad that you guys see value and wish to allow us to, give us money to do this, because we don't make money off of it. We don't expect to. We're on LinkedIn. We're on Facebook. We have a Facebook group, facebook.com/Breaking Down Security. You can find our RSS feed at breakingsecurity.com/RSS. And that was it for this week. Catherine, you're if you want to talk about any other privacy stuff, or I really would like to pick your brain a little bit more about the ethical researching stuff. I would love to have you come back. That would be great. Don't be a stranger. Don't be a stranger.
I won't. Thanks so much for having me.
Yep. Mr. Boettcher, it was great having you back, sir. You were definitely missed. I wasn't trying to replace you in any way, shape, or form. So,
it's good to know that we had some really great talent come on and fill in for me. That's awesome.
Yeah, and there was no shortage of it, and they answered the clarion call when I asked for help. So that was awesome, and I'm looking forward to seeing you in about a month and a half time. DerbyCon will be the first time in about a year and a half, so that's fantastic. So from the Breaking Down World headquarters, this is Brian Brake, Brian Boettcher, and Miss Carpenter. Have a great week, and we will all see you very soon.
Bye-bye.
Bye.